Welcome back to the Health Revival Show. We are so excited for another interview, and I think this will be a good one because we have talked a lot about Hashimoto's and hypothyroidism. We have not touched as much on Graves' disease. It is not as common, but a lot of people still struggle with it. And I think that this podcast is going to be amazing. We have Dr. Eric Osansky with us. He is a chiropractor, clinical nutritionist, and certified functional medicine practitioner who struggled himself with Graves' disease. And so we are so excited to have you. Thank you for joining us. Please tell our listeners a little bit about you and about your story, that how you kind of came upon this expertise area.
Yeah, of course. And Liz, Becca, thank you so much for having me. I'm excited to chat about hyperthyroidism and Graves. And yeah, so this it started happening in late 2007. I was dieting and detoxifying. I was exercising intensely and I was trying to lose weight at the time. I was 182 and like to be between like 165, 170 and I'm giving those numbers for a reason, just because I ended up dropping to 140, which losing 42 pounds, which was definitely a lot more weight than I was trying to lose. And along the way, I didn't realize that I was in the process of I was dealing with hyperthyroidism. I thought it was just due to the dieting and detoxifying and exercising. But one day I was walking around a retail store and they had one of those automated blood pressure machines, and I took my blood pressure, which was fine, but my resting heart rate was 90. And well, I don't know if we could say it was resting because I was walking around the retail store, and that's what I thought. I'm like, yeah, maybe just walking around. Maybe I was just walking around too fast. But the next few days I would take my pulse rate manually and it was anywhere between 90 and 110 beats per minute, and that's when I realized, okay, something's up. And long story short, went to a primary care doctor, and he did some basic testing, just a TSH and a T4, and that alone showed that I had hyperthyroidism, which would explain at least partially the weight loss. I'm sure some of it was due to the exercise and dieting, but not the whole 42 pounds. And then eventually I went to an endocrinologist, got the official diagnosis of Graves. And at that point, it was new to me. So I had no experience dealing with hyperthyroidism Graves, but as part of my continuing education credits, I would take nutritional seminars and functional medicine seminars. And I did take a few functional endocrinology seminars prior to my diagnosis, not knowing that I would actually incorporate the information, at least not by myself, like just utilizing it on myself. And so yeah, I knew that there was hope to try to get Graves into remission naturally. Again, I didn't know if I would be able to. Again, I still was skeptical, but yeah, I was able to through diet, lifestyle. I know we're going to talk about some of these things: stress management, taking some supplements. Was able to restore my health, and since then, 2009 is since I've been in remission and been helping others, mostly with hyperthyroidism and Graves' disease since then.
Amazing. And I'd love for people that are listening, just because I think Graves is not talked about as much, it's not as common. Can you give a little bit of quick background on what is the difference between Graves and hyperthyroidism and what you'll see on labs versus Hashimoto's and hypothyroidism?
Yeah, sure. So most are familiar with hypothyroidism, like you said, you've spoken about it a few times. So with hypothyroidism, typically on a lab that will present with TSH, thyroid stimulating hormone, which is more of a pituitary hormone. So that communicates with the thyroid to produce more thyroid hormone. So in the case of hypothyroidism, so in hypothyroidism, you'll get higher elevated TSH, and then thyroid hormones will either be low or they might be subclinically low. So they might be within the lab range, but on the lower side. Um, with hyperthyroidism, it's the opposite. You have an elevation in thyroid hormones, T4 and T3. And because you have too much thyroid hormone, the TSH will communicate, the pituitary essentially will communicate with the thyroid and say, hey, we have too much thyroid hormone. We need to slow down or stop this production. And as a result, the pituitary gland will hardly produce any TSH. It'll be like, typically it's undetectable, especially in Graves' disease. You'll see like less than zero point zero 0.01, for example, on a blood test. And Yeah, so that's hyperthyroidism versus hypothyroidism, and with the symptoms you'll get because everything is increased. The thyroid hormones typically you'll get elevated resting heart rate, like I experience, heart palpitations, tremors, anxiety, insomnia, increased bowel movements are common. Weight loss is typical. Again, there are some people that do actually experience weight gain, even though they have hyperthyroidism Graves, but the classic symptom is weight loss. And then with Graves and Hashimoto's, those are both different autoimmune conditions that affect the thyroid gland. So with Graves' disease, you have elevated thyroid stimulating immunoglobulins, which is a type of TSH receptor antibody. So they attack or bind to the TSH receptors, which is what causes the increase in thyroid hormone. And also worth mentioning that some people have thyroid eye disease, where those same antibodies attack the tissues of the eyes and can lead to bulging of the eyes, swelling, sometimes double vision. And then with Hashimoto's, you just have different antibodies. You have thyroglobulin antibodies are closely associated with Hashimoto's, and thyroglobulin is a part of the thyroid. So when you have those antibodies, that means there's damage taking place to thyroglobulin. And then thyroid peroxidase or TPO antibodies, which is the most common type of thyroid antibody. Very common in those with Graves as well, but it's again more of a more closely associated with damage. Thyroid peroxidase is an enzyme that's important in the production of thyroid hormones. So yeah, and then some people have all three antibodies, which we definitely could talk about. But that's really the difference between hyperthyroidism, hypothyroidism, Graves' disease, and Hashimoto's.
Yeah. Thank you for explaining that. And can you elaborate a little bit more too in terms of how some people start to flip back and forth and what might be causing that? Maybe some of the triggers here as well when we're thinking about autoimmunity. We know this is an imbalance of the immune system mistakenly attacking its own body tissues, and in this case, right, the thyroid gland. So I'd love for you to kind of, discuss what does that look like when people are flipping back and forth? Is it solely that you're seeing these symptoms where, for a period of time, they're going very anxious and almost like I just say the gas pedal is all the way to the floor, right? Where they are, running just hot and they are losing all this weight. And then all of a sudden they're, flipping and now they're cold and they're, gaining the weight back and things like that. And they're tired and maybe losing hair, brain fog. So, what do you see in clinical practice for those that are flipping back and forth and some of the common triggers for all of these Graves, Hashimoto's, and let's say the combo.
Yeah, great question. So there could be a few reasons why people flip back and forth. And so one is I just mentioned people can have the antibodies for both Graves and Hashimoto's, and it's actually quite common to see someone with like thyroid stimulating immunoglobulins and or thyroglobulin and TPO antibodies. And when someone a lot of times it could go either way. Like I've had people with Hashimoto's have a history of Hashimoto's, but then all of a sudden they start becoming hyper, and it's found out that they have those thyroid stimulating immunoglobulins, and so yeah, now they're diagnosed with Graves. I'd say more common is someone who has Graves disease, and then that's causing a stimulation of thyroid hormone and that's predominating, but kind of in the background, if they have those Hashimoto's antibodies, there could be damage taking place to the thyroid gland. And so it's usually more of a gradual process. It's usually not where they're hyper one day and then like it just a switch flips and they're quickly hypo. That's usually not the case. Now there's also hashitoxicosis, and hashitoxicosis is when someone has Hashimoto's thyroiditis with transient hyperthyroidism. When you get damage to the thyroid gland, you get the rush of a thyroid hormone into the bloodstream, and that's could be a quicker process where someone kind of like seems like they're going back and forth. They might be hyper. One day it seems like and hypo the next day. So sometimes that does happen with hashitoxicosis, and then there's also subacute thyroiditis. Subacute thyroiditis is usually caused by a virus, and it's when someone starts out as hyperthyroidism. The virus is damaging the thyroid gland and presents as hyperthyroidism, and usually they make the switch to hypothyroidism for a few. Usually, it's like they're hyper for Could be a few weeks, could be a few months. They switch to hypothyroidism, which could be a few months also, and then usually they become euthyroid, which means they have normal thyroid hormones. So those are some of the different situations where people might go from hyper to hypo, or again, sometimes hypo to hyper. And then as far as triggers go, so it's funny because I have three books related to the to thyroid health. One of them is called Hashimoto's Triggers, and sometimes I kid around and say, I could probably cross out Hashimoto's and put Graves' disease, and like 80 to 90% of that information will be the same as far as the triggers go. Um, because again, there's definitely a lot of overlap when it comes to the triggers of not just Graves and Hashimoto's, but all different autoimmune conditions. And the main four categories of triggers that I talk about. So we got food, such as gluten, for example, that could affect the immune system, also could affect the gut because increased permeability of the gut, which is leaky gut, which could be a factor with autoimmune conditions like Graves and Hashimoto's. We have stress, which I think we're going to talk about more, and that could be a big factor and was a factor with me too, as well. And it's not just emotional stressors, but physical stressors too, which again, we could touch upon that. Um, Environmental toxins or toxicants. Again, we definitely live in a toxic world, and just it's I was going to say difficult, but really impossible to completely avoid all the toxins and toxicants out there. So all we could do is, I mean, we could do a lot, but we minimize our exposure to toxins and toxicants, especially in our own home. And then the fourth category I talk about infections, viruses, bacteria, parasites, stealth infections like Lyme could be factors. And I mean, there are other underlying imbalances like nutrient deficiency. Some will call triggers, but to me, it's more like an underlying problem than an actual trigger. But yeah, we obviously nutrients are important as well. But yeah, those in a nutshell are the four categories. And then obviously within each category, like someone might say, well, how about mold? Well, mold to me would fall under the mycotoxins, under the environmental toxins. And yeah,
Yeah. Heavy metals, all the things.
exactly. Yep.
Yeah, and I think you bring up a great point here. For everyone, their trigger is going to be a little bit different, or it can be a combination, right? A
Yeah.
cluster of these things. I was diagnosed with Hashimoto's. My TSH was fine, but I had very low T3 and I was very constipated. And then, obviously positive antibodies. And so the first approach was stool testing. And there we found, parasite, candida, H. pylori,
Yeah.
dysbiosis, right across the board, all the things, just kind of an open door, welcoming in all those infections and upregulating the immune system's response. And then I want to go back to what you mentioned in terms of food, and I want to cover two things here if we can. So, number one is gluten. I always try to explain to people, especially if they have positive antibodies, that gluten at a cellular level mimics the thyroid gland, and so that's why it can exacerbate this issue. And if we're removing gluten, we have to sometimes think about the cross contamination. We also have to think about cross reactive, like other grains, maybe in some cases, depending upon the person, right? What's their stool testing telling us, and the mucosal lining and integrity of that. But so many people will ask, and I honestly would say that I think I differ from some people who say, absolutely 100% gluten free for the rest of your life, even if you've reversed and put it into remission. So I'd love to hear your thoughts on that. As far as gluten, if someone is able to reverse the issues, they've addressed the underlying root cause, they are negative with antibodies, their thyroid levels look great, in meaning optimal TSH, optimal T4, T3, do you still believe that person should be 100% gluten free?
So, I mean, I agree. While healing 100% gluten free, I've been in remission since 15 years now as a recording this. Actually, I guess closer to 16, 2009. But either way, I'd be lying if I told you I like have had zero exposure to gluten, since
Yeah.
2009. Now I do try to, for the most part, I avoid it. And I mean, should we 100% avoid it? I mean, we probably should, because it could, like I don't feel bad, when it comes to consuming gluten, but it also does affect the gut, even if we don't feel bad. So I definitely try to minimize it, and especially in my own home. But even if I go out to eat, I still try to minimize gluten. But do I go to the extent where I'm trying to avoid cross contamination? Like if I go out to eat, no, I don't usually. Like I won't say like wear gloves or or talk to the waiter or waitress or the cook. So yeah, I mean I've had some gluten exposures, and like I said, I don't feel bad when I get when I so everybody's different. So that just because I feel okay, and like I said, even though I feel okay, I try to minimize it. And then there are different sources of gluten too. So it's like if someone has like Ezekiel bread, like a more healthier form of gluten compared to just because again the question is also is it a gluten or is it the glyphosate, as
Yeah.
well. So that's another issue too, where someone might feel horrible eating wheat in the United States, but then they go somewhere else like Italy and they feel fine, and so maybe it's not so much the gluten. So I I do think it's individual. I mean, if someone has celiac disease, obviously, yes, I would say 100% avoid gluten, and that includes like things like sourdough bread, because are some studies, studies showing that maybe it's okay to have sourdough bread, but it seems more recent studies show if you have celiac, you should avoid those.
Mhm.
Um, but yeah, so I would say everybody's different. I think most people should minimize gluten, but I don't know necessarily if everybody needs to 100% avoid it permanently, even if they have an autoimmune condition. Like again, I haven't, knock on wood, I haven't relapsed because of the exposures. Now, maybe if I had it every single day or even every every week, maybe it would be different rather than indulging every now and then. But like I said, that's where it comes to biochemical individuality because everybody is different.
Yeah. Thank you for that. And thank you for bringing glyphosate up. So I just want to say, when we're looking at the use of glyphosate and we can correlate, we can't necessarily say this is causation, right? But we can look in the research and we can see the rise in celiac disease with the increasing use of glyphosate. And I think that's a really big miss for many people. They don't understand that it's not always the gluten. Everyone demonizes gluten, that really, what are we talking about here? We're also talking about the way that things have been genetically modified compared to, thousands of years ago when we weren't using. And actually, there's new studies that just came out showing that the Roundup, the new formulation of Roundup, is even more toxic than the previous Roundup. So, if you go online and you research this, you can see things like IBD, and some of these other inflammatory conditions in the body also at the same time that glyphosate is rising in the use of, on our crops and everything, we see the rise there. So correlation, causation, I'll leave it up to the people. But, I think for me personally, I think that it's a bigger issue with glyphosate and atrazine than it is actually gluten itself for most people, right? Going back to the case of we're not talking about when you're in a healing journey. Obviously, in a healing journey, I tell everybody, and I think you would agree here, we're removing as many triggers from the fire. And if that is one of those things that is upregulating the immune response, damaging the mucosal barrier, that's not going to help us at all in our healing journey. So thank you for bringing up the glyphosate because I think that's a big point a lot of people overlook. So let's talk about what causes autoimmunity, right? So we're talking about Graves and Hashimoto's, two types of autoimmune, but we know that there are over 100. And what we really need is to bring back homeostasis to the body and put this at bay. So what do you see as, deeper diving here? What really causes this?
Yeah, it's a great question. And again, when we was talk about the triggers briefly, I think you mentioned that there could be multiple triggers, like there could be multiple factors. So it's not like there's different triggers. Different people have different triggers, and in my case, stress I think was a big factor, and I find it to be a big factor in a lot of people with Graves. And it's not just emotional stressors. I mean, that's big, but one thing I mentioned, I was working out intensely and I was guilty of over exercising, overtraining. And so I'm pretty sure that that was at least a factor in the development of my Graves' disease condition. I mean, there's also a genetic predisposition as well with it seems with autoimmune conditions, but the good news is while you can't change the genes, you could change the expression of genes, and by removing the triggers, healing the gut, you can reverse autoimmunity. But stress is big. Again, we mentioned the food, and again, not just gluten, but other foods as well. I mean, I typically have people avoid the common allergens, at least while healing initially, things like gluten and dairy and corn, and honestly go beyond that and have them take a break from grains while healing. But again, infections could be big as well. So during the pandemic, 2020, 2021, we had a lot of people come in with hyperthyroidism graves with COVID. So even before that, Epstein Barr, we know there's in the research again, like you said, correlation doesn't always mean causation, but there are a number of journal articles showing relationship between Epstein Barr and Graves, as well as Hashimoto's, uh, H. pylori in the literature as well. And again, it's a little bit controversial. Some will say don't treat everybody for H. pylori, but again, it's in the research. I've seen people where where I've treated H. pylori and they've gone into remission. Now, again, could it be because we were doing other things too, and it wasn't just the H. pylori? We're also telling them to clean up their diet, manage their stress, make sure they're getting proper sleep. Yeah, of course. Like the foundations are always going to be important, but yeah, so the infections could be big. Again, we mentioned environmental toxins and toxicants, the heavy metals, the xenoestrogens, including microplastics that could not only disrupt the thyroid gland directly, but then also could affect the immune system. So yeah, I mean, those are some. I mean, molds. Again, I mentioned molds earlier, and some people the mycotoxins could be a big factor. So it's again a lot of different things, but I'd say start with the foundations because a lot of people just and we had this conversation before pressing record a little bit about stress and how stress alone could be a big factor. So even just cleaning up your diet, managing your stress, getting sufficient sleep in some cases can make a huge difference, or in a lot of cases can make a huge difference. You might just there in many cases you might need to go beyond that, but you always want to start with those foundations.
Yeah. And I think a lot of people struggle because they want to know why. Why did this happen to me? What? It's like it could be a lot of things. And typically, there is never one root cause. It is multiple things going on that kind of tipped you over that chemical, mental, emotional, physical threshold of balance, right? And for you, it was there maybe were things brewing even before overtraining and overexercising. And then it was just too much to the body. And I love how we've been talking about the pulling back that threshold is ultimately during healing. You have to work a little bit harder. You have to do a few more things that maybe you don't want to do, like remove foods that you used to enjoy, or pull back stressors that you thought were okay, and obviously they aren't because they pushed us over the edge. And so I think ultimately what it is okay, I'm dealing with this right now. Look at what maybe contributed to it, even though it might not be one answer that you want. You want a test to give you, like, this is why you got Graves. This is why you got Hashimoto's, whatever it might be. Genetic predisposition, of course, plays a role, but the goal is to slowly pull back the stressors that kept you over that edge. And so, in terms of treatment options for Graves' disease, Hashimoto's disease, all of these different aspects that people might be dealing with, what did you do? What do you see effective in working with these clients on a regular basis, both conventional and, functional holistic? Because I think both can have a place sometimes. But would love to hear, what you found successful and what you see as treatment options for people.
Yeah, well, I think it's important to mention, especially with Graves and hyperthyroidism. Again, we want to go beyond symptom management, but we also want to be safe as well. So, like if someone has a resting heart rate that's in triple digits and experiencing all these symptoms, and we know elevations in thyroid hormones can also affect bone density in a negative way, while addressing the cause of the problem, we want to do something for the elevation in thyroid hormones. Now, typically, antithyroid medication is given in the case of hyperthyroidism, and I was able to avoid the medication by taking herbs. I took one called bugleweed, which is not too well known in the functional medicine world because it's more specific for hyperthyroidism. It has like all herbs, there are other benefits, but that seems like where most practitioners when they give bugleweed, it's for lowering thyroid hormones. But so I took bugleweed, I took motherwort, And yeah, a lot of my patients have been able to do that as well. Some people do need to take the anti-thyroid medication. So if someone is listening to this, watching this, they're taking methimazole, which is what's commonly prescribed in the United States. Again, you might need to take it. So I'm not telling someone to stop taking that, but it is possible in many cases to manage the symptoms naturally while addressing the cause of the problem. And of course, with Hashimoto's, sometimes there is a time and place for thyroid hormone. I mean, I think it's overprescribed and too many people are taking it. But again, if thyroid hormone's really low, you might need to take it. Maybe you do. Some people need to take it long term. Some people temporarily while addressing the cause of the problem. But remember, these are immune system conditions more than thyroid conditions. So need to,
Yes.
yeah,
Amen.
exactly. So yeah, as far as treatment wise, besides managing the symptoms, I mean, we want, like I said, I know I'm going to sound like a broken record, but incorporate the foundation. So diet, stress management, sleep. I do like to do some functional medicine testing as well. I like to look at adrenals just because, again, we could guess and say, yeah, most people are dealing with stress, but I was honestly, I was in denial when I dealt with Graves, and I didn't think stress was a factor. I had to see how bad my adrenals were before I did anything to improve my adrenal health. And some people are the same way. Some people maybe aren't the same way. Maybe they are dedicated when it comes to blocking out time for stress management. But yeah, so focusing on adrenal health, doing things to reduce one's toxic burden, time and place for gut related testing, like a stool, comprehensive stool panel to see if someone has parasites, H. pylori, other imbalances, opportunistic bacteria. Some people might have a lot of bloating and gas, so we might need to do a test for SIBO, small intestinal bacterial overgrowth. And so, if that's the case, we'll put them on an antimicrobial protocol for SIBO. Or again, if they have parasites, maybe make some tweaks depending on what they're showing up. So again, really, the treatment varies depending on what triggers and underlying imbalances people have. I mean, I will say there are some general things I recommend, like I'll have almost everybody supplement with an omega-3 fatty acid, typically like a fish oil, because I find most people are deficient. Um, I have everybody test for vitamin D, and I'd say most people are low in vitamin D. So recommend usually supplementation, but obviously you want to try to do as much with through the sun too. Get regular sun exposure to also help with vitamin D and help with your circadian rhythm as well. I mean, usually I have people take probiotics, but also encourage them to do things like eating fermented foods. I mean, you want to do as much as you can through the diet, but there's a time and place for supplementation. Same thing, selenium for Hashimoto's and Graves. And again, can we eat Brazil nuts? I eat Brazil nuts. I get Costco organic Brazil nuts. But the thing is, with the Brazil nuts, you just don't know how much selenium is in each Brazil nut. So honestly, if I'm going to help someone increase their selenium levels, usually while healing, I'll tell them to supplement with selenium. And then when they're in a state of wellness, yes, I can't say I don't take selenium supplements on a wellness basis. I do, again, like I just mentioned, I'll eat the Brazil nuts. But yeah, so like I said, there are some things that I recommend for most of my patients, especially the foundations and some basic supplements. But really, the treatment recommendations, it depends on the testing. Do we have what do we have show up on a comprehensive stool test if we do that, or if we do an organic acids test, or other types of testing. And again, I try. I'm not like I don't do an excessive amount of testing. I mean, if anything, I'm usually conservative initially and hope to, and if we, but it also depends on the health history. If the health history dictates that the person needs 4 or 5 tests, in addition to comprehensive blood testing, because I do recommend comprehensive blood testing on everybody. But when it comes to the functional medicine test, it does depend on the person. And then the treatment does depend on what we find on those functional medicine tests, as well as the blood test.
Yeah, and I like that you mentioned the overprescription of medication because I think people think thyroid medication is an answer a lot of times to their metabolism and their weight gain and, their energy and brain fog and they're feeling cold or whatever it might be. Um, and we harp so much like thyroid problems are not thyroid problems. They are full body problems. And the thyroid is just the governor of the body, trying to hang on, trying to keep you alive, trying to make sure that you don't overdrive or underdrive. And understanding that they don't come with lack of repercussions. Like if you just dose thyroid medication high in either situation, you're going to burn out the thyroid. You're going to completely impair your body's ability to function normally that it may have had if you had reversed this with mainly functional and holistic approaches, which in most cases you can. And so it's just thyroid medication is not harmless. Like it definitely can impair long-term function. We have people that come to us that were on 225 micrograms of levothyroxine, can't get off of it because they have been on it for years. And now you have completely shut down thyroid function on its own. And it's like, we're going to have to take, whether it's at that dose, hopefully lower, but like, we're going to have to take thyroid medication probably now because we have burned out the function of the thyroid. And so it is epidemic of prescribing thyroid medication unnecessarily because I'm sure as you can attest to, you just talked about like people can go back and forth on a daily and weekly basis sometimes when they're really dysfunctional. Thyroid's constantly moving. And so if you are trying to fix it with a dosage of a thyroid medication, you're just shooting in the dark every day because you don't know what the thyroid function is going to be that day based on your stress and what you're changing. And it's kind of like HRT too. Like you might need to change dose. And so thank you for bringing that up because we see it so much, and especially in your situation where you're working mainly with thyroid type patients and clients, it's not an answer usually, and it's not harmless. And it's just, I feel like we need to say that again in terms of reminding people that it's not your weight loss drug. I'll say that. And in your situation, we have, I don't know if I'm trying to remember the company that it's from. There's a product called Hyperthyroid Balancer. And we use it in our Graves cases and in our hyperthyroid cases, and it is like amazing. It's I'm sure it includes a lot of the herbs that you mentioned right then. So you also mentioned the gut and H. pylori. So would love for you to open up a little bit in terms of like the gut thyroid connection that you see, because I see H. pylori present often with Graves' disease. So would love for you to kind of expand on that.
Yeah, well, so a few things that's important when talk about the gut and thyroid. So again, most thyroid conditions are autoimmune. So I think like about 90% of people with hypothyroidism have Hashimoto's. Same thing with hyperthyroidism. Most people have Graves. Yes, there are exceptions. Even in those exceptions, optimal gut health is important too, though. So if someone's listening and they have a non-autoimmune thyroid condition, again, it's not like this is irrelevant to you. I mean, but most of the immune system cells are located in the gut, so you definitely need a healthy gut to have a healthy immune system. So if you have a lot of dysbiosis, you have that increase in intestinal permeability. Again, it really will be difficult to heal. And then speak of that increase in intestinal permeability, that's part of that triad of autoimmunity, that three-legged stool of autoimmunity, where you again that genetic predisposition, but then also you have one or more environmental triggers, and again that leaky gut. So again, healthy gut, healthy immune system, also some of the so when it comes to thyroid conversion, converting T4 to T3, you need a healthy gut, also healthy liver. A lot of the conversion takes place in the liver, but if you have a disrupted gut microbiome, that also will affect that conversion. So you might show up on a thyroid panel as having a good looking T4 but a lower T3. And again, it doesn't necessarily mean it's related to the gut, but let's face it, a lot of people have imbalances in the gut, have gut dysbiosis. And so, yeah, that's so you're absolutely right. You need to have a healthy gut in most cases to have healthy thyroid. And even I'll bring up a non autoimmune case, like there's what's called toxic multinodular goiter, which is when someone has hyperthyroidism and they have multiple nodules and they also have a goiter, enlargement of the thyroid. And when it comes to nodules and goiter, one issue could be problems with estrogen metabolism, problems with essentially detoxifying the estrogen. And that also could be related to the gut as well. If you have a lot of dysbiosis, then you might have issues with estrogen metabolism. And yeah, so again, even if you have a non autoimmune thyroid condition, you still want to do things to, and then obviously nutrient, like I almost forgot about this. This is very important. If you don't have optimal gut health, well, you might not be able to digest and absorb the selenium that we mentioned earlier, as well as other vitamins, minerals necessary for thyroid health. Things like iodine, things like iron, vitamin A, which is important for the thyroid hormone receptor. I mean, tyrosine and other amino acids. So yeah, without it goes without saying, you need a healthy gut to have a healthy thyroid.
Yeah. I think many people think that if they're going to, take the thyroid medication, everything is just going to be fixed, like Becca was saying, and they disregard everything else that's really underlying root cause of why this is happening. And so then what we see a lot of times is people are just increasing the dose, and they're saying, well, I'm not feeling any better and things aren't working and I'm still tired and I still can't lose weight and, all these things. And it's like, we continue on our podcast, as you heard us in the last episode and many other episodes that we've talked about. The thyroid is the canary in the cave here, right? If we don't fix the immune system and bring that back into homeostasis and bring balance back to the body, we're going to continue to chase symptoms, and you're going to continue to, play with your dosing, and it might work for a little bit and then it doesn't. And that's really because the underlying issue is that poor detoxification, right? Because really, I think for everyone who's struggling with any type of infection, a large part of it is not just the immune system, but also the inability to get rid of it, right?
Yeah.
Whether it's the liver that's congested and not able to, properly conjugate things, if it is that they're not going to the bathroom every day. Like, there's a variety of factors here that come to play. And so I just love that you touched on that and how it really is a whole body picture here when we're thinking about the thyroid, whether or not it is autoimmune or it's just hyper or hypo. So I love this. As we start to, wrap up here, we always ask people, if there's one thing you had to shout from the mountaintop, what would it be, for individuals to really understand about their thyroid and this interconnectedness within the body?
Yeah, hard to just choose one, as I'm sure many of your other guests have found that to be a challenge. I mean, getting back to the stress. I mean, because stress is something that I think a lot of people overlook. I mean, a lot of people make changes to their diet when they work with me. And even prior to working with me, a lot of people have already made dietary changes, but I don't think enough people are blocking out time for stress management on a daily basis. So it's not enough to do it like twice a week. I mean, it's great if you're doing yoga, let's say 2 to 3 times a week, but you need to, and not to say you have to do the same mind body medicine technique every single day. You can mix things up definitely, even if it's just deep breathing every day, but do it daily and start. I recommend starting with 5 minutes per day, just to get in the routine of blocking out time for stress management. And you might need to go. I mean, you probably need to go beyond 5 minutes per day, but you might need to go beyond deep breathing. There are other things like vagus nerve exercises. You mentioned, I think, before we press record, like nervous system retraining, things like that. So there's definitely a time and place for that. But again, just start with some deep breathing, 5 minutes per day, every single day, and take it from there.
Yeah, I couldn't agree with you more. I think we were talking offline. I'd love to elaborate here if we can. You mentioned, stress was a big trigger for you. You were overtraining. Not sure if you were under eating, but definitely in the female world, we see that a lot too. So they're overtraining and then they're not replenishing nutrients and everything is just even a bigger stress. But, I would love if you could share what maybe your top tips are for individuals who have put this into remission, whether it's Graves or Hashimoto's, and then they go through a really high stress time and it's uncontrolled. So it's external stressors that they're not able to control, but it's definitely impacting them internally. Where would you say, beyond that deep breathing, that you would have them kind of focused if they're more in a flare?
Yeah, it is a good question. I mean, in that case, again, I still would recommend the deep breathing. I mean, you still can't overlook the foundations, but in that case, I mean, you also need to look at other areas too in that case too, not just the stress management. You might need to, like, if I relapsed tomorrow or today, and if I knew it was a stressful situation, I would still kind of evaluate everything as well, like make sure, am I still eating clean, like, most of the time, and if I relapsed, obviously go back to being super strict with that, and everything else that we discussed as far as the foundation. So besides incorporating the foundations and again blocking out time for stress management. I mean, the vagus nerve exercises a lot of times, like just doing other things to help balance the parasympathetic nervous system. And again, you might need to go beyond that, like you said, the nervous system retraining as well. But even starting with doing things like the vigorous gargling, the cold showers, the um, again, some say coffee enemas. I can't say I do coffee enemas personally, but that also, I guess, is an option. But just the deep breathing, singing loud, taking the cold showers to help stimulate
Okay.
that vagus nerve. And again, there is a time and place for supplementation. Supplementation is never a substitute for eating well and stress management. But and that's where like the adrenal, where I like testing adrenals, because again, depending on how the cortisol levels look, you know, that might determine what I recommend from a supplement standpoint. But yeah, so those are some of the things I would recommend if someone's in an acute flare. But again, you might it's there's probably not a quick thing that you could do where it's like it's gonna. I mean, it really depends on person. I shouldn't say that. Sometimes there might be, but again, you might need to dig deeper. Sometimes the stress is like I forgot if it was you or Becca that said that earlier. Almost like kind of like the straw that broke the camel's back. So it's not like the acute straw, because again, we're all gonna be faced with both acute and chronic stress situations in our life. And it doesn't mean it's always going to result in a relapse. When it does, sometimes it might seem like it's a stressor. But again, there were other things besides the stressor that maybe we were falling a little off the wagon with, and we just need to get back on track.
Yeah. I think sometimes people expect that we're going to have some fancy answer. And the hard part here is that when we really truly think about how the body is designed and how it communicates, even at a cellular level, it has to always go back to the foundations. And one thing that I tell my clients is you need to be thinking about your inputs versus outputs here too, in terms of your stressors and finding joy. I think that's a big thing that people often overlook when they're in a really stressful situation. Like, okay, how do we set this aside and then go with your friend or go to watch a comedy, right? Turn on Netflix, turn everything else off and just turn on Netflix, or like go to coffee with a friend and really just try to separate everything, because again there can be so many inputs. So thinking about, are you putting more positive inputs in rather than negative, because that's just going to exacerbate some of those other stressors. And so, obviously, we would agree with everything that you said there. It's all foundational. We can't skip the basics, and medication isn't going to fix it without addressing the underlying
Yeah.
root cause and the dysfunction. So, thank you so much for your insight today and sharing your genius with us. If you would please let our listeners know where they can find you. They can purchase your books. So, he does have several books. He has Natural Treatment Solutions for Hyperthyroidism and Graves' Disease, the Hyperthyroid Healing Diet, Hashimoto's Triggers, and then also a podcast, Save My Thyroid podcast, and a newsletter as well, Healthy Gut, Healthy Thyroid. So funny that's your newsletter, because our program in our practice is Healthy Gut, Happy Hormones. So we love that. Very similar there. But let our listeners know where they can follow you, connect with you, and purchase one of those books if they choose.
Yeah, well, the books you could just probably the best thing, just go on Amazon and just if you type in my name, Eric Osansky, or again even hyperthyroidism or Hashimoto's triggers, you could find the book. Say My Thyroid, just saymythyroid.com, where you could also find the books as well. But it'll lead you to Amazon, so you might as well just go to Amazon. And then yeah, the newsletter, Healthy Gut, Healthy Thyroid, you could check out by visiting saymythyroid.com/newsletter.